Hello and welcome to the Health Leader Co podcast. Today I am joined by my co-host Christine Knox and we are talking all things gentle scar therapy. The reason that we are sharing so much about scars is because it is a pioneering modality. As a therapist who has been treating for the last 25 years, I did not even know that gentle scar therapy was a thing. I didn't see that scars were affecting my clients. And for me, my education into scars has been as somebody with I'm a person who lives with scars, having major back surgery at 15. I also compound fractured my left leg when I was 10, and I've had hernia surgery as well. So I live with multiple scars and had absolutely no idea how those scars could be or were actually affecting my body. So this conversation is for anybody who is new to the world of scars. If you are seeing scars in your clients and maybe you were taught to, I wasn't even not taught to look at them or touch them or anything. They weren't even mentioned when I first studied. And so if you're like, I've never heard of this before and I'm kind of new, please don't feel like you're the odd one out, because this is new for a lot of us because it is a pioneering modality. If you are like all over scars, like what? How could people have not heard about scar therapy? You've got to be kidding me. Maybe you're in lymphatics or you've done oncology. Like there's loads of different people out there and therapists that listen to this. But what we wanted to do was sit down and have a conversation with somebody who understands a lot around the scar therapy, which is Christine, and also from my experience as a practitioner who was completely unaware of how this was helping or affecting or hindering my progress. So we hope that you enjoy this conversation around all things scars. Hello and welcome to the podcast. Today, Christine and I are hanging out to talk all things scars, which is pretty cool. Hey, Christine.
Hey, Elicia. How are you?
Good. How are you?
Yeah, good. Keen to talk about scars.
Let's do it. So how many years have you been interested in scars?
Oh, since 2010.
Oh my gosh, that's like 20 years. That's 16 years. Crikey. Yeah. Wow.
Yeah.
Okay. So scars and scar therapies is what we call a pioneering or emerging modality. Now, can you tell us a little bit about your experience back in 2010 that made you unbelievably curious to study everything there is to study around scars?
Yeah. So, back in the day, I was doing a lot of workshops, like taking them as a student. And I turned up to workshop this one day and I had really terrible period pain, like the worst. And I tried painkillers and stretching and breathing and, took a longer walk to the venue thinking that's going to help. But no, nothing helped. And I actually felt quite queasy. I had pain across my low back, pain across my abdomen, pain actually down my quads. I felt just pretty horrible. And I probably didn't look that wonderful either when, when I arrived. And so I'm just like, oh, okay. I was like, oh no, I just got terrible period pain. They were like, oh, well, I can help with that. If you pop on the massage table in the break, I'll see what I can do. And I was like, oh, okay, that sounds awesome. Got to the break, jumped on the table, fully clothed. And this person did what I didn't know what it was called then, but they basically made a Christine sandwich between their hands. Yeah. Through my clothes. So I was lying on the table, fully clothed. They made a Christine sandwich. So one hand underneath my sacrum, one hand on my abdomen. And I'm like, well, this is it. It's still work. It's very, very still work. And I was a bit like fidgety and like, dude, I was expecting, some trigger pointing or something else. I was not expecting still work through my clothes. Anyway, so she was a very experienced therapist, very confident in what she was doing. And then she just leaned right in and she said, Christine, when did you get your surgery? And I went, oh, how do you know I had surgery? And she said, I can feel it. And I was like,
What?
that makes no sense to me at all. You know? And I was a bit weirded out by that. And I just went, oh, weirdo. She's so weird. Anyway, she stayed there maybe 5 minutes. It felt like half of my life had passed. It was so long. And I was a bit like freaking out the whole time, thinking this person had some sort of incredible power to read my mind. Anyway, she didn't have that incredible power. What she did have, which was an incredible power, was the ability to help me through these period cramps. And she was like, slid one hand off of the top and the other hand from out from underneath. And I was like, ooh, that feels weird. And she said, just stay there for a second. And she held my feet and grounded me a little bit. And then she just said, no, when you're ready, just gently get up. So I did. And she was like, just sit with your feet on the floor for a second. And for people that don't know me, I'm very, very sensitive to body work. So I was quite spaced out. And I was like, oh, okay. And then when I felt ready, I stood up and I walked around and I kind of went, that feels incredibly different in my body. And I couldn't quite put my finger on it. And then I realized I wasn't actually having any period pain or back pain or pain down the fronts of my legs, my quads. And I thought, whoa, how did that even work? What was that? And how did that work? And how can I do that to other people? So that was the story.
Wow. It's just mind-blowing that something so gentle can have such a quick and profound effect. And so what did that do for your curiosity? When you say you were doing some courses, how many courses did you end up doing?
What, on scars?
Courses.
Probably done a total of about 5 or 6 scar courses.
Yeah.
And I've done other courses, which then there were people on those courses with scars. And there was very experienced people in the room who then went, oh, we'll just show you a little thing. Because I would say, oh, I see they have a scar like this. And say, oh, we'll show you something really cool here, Christine. And then they'd show me. They actually showed me a transverse plane for someone who'd had laparoscopic incisions on their abdomen. And then all of these lines just appeared on their abdomen, going to where the area of interest was for the surgeons. And there was another line and it was like, oh no, they just went for an investigation down there. It was like, wow. So I know it just looked like someone had come along with a red marker and just drawn on it. I was like, wow. So yeah, I went and studied a lot of different types of things. And then that led into other types of unusual courses. So I went and studied a breast course. So 2 days of how to touch people's breasts in the UK, myofascially. And that, of course, led into people having vasectomies and reconstructions and just different types of breast surgeries that then I was like, oh, yeah, then proficient in all of that. And then I did another one on abdominal scars, with different people from all over the place. So, yeah, it was pretty cool. Pretty cool.
And you love the science behind fascia and scars and how that works. And you also love a little bit of the woo-woo as well, or however you want to describe that. Tell us a little bit about the science behind scars that you love.
Oh, yeah. What don't I love about it? The fascial component is fascinating. And what I really love is the intelligence of the body, that healing process itself. For me, the intelligence and beauty of the body is just fascinating and so underappreciated. And I think it's quite arrogant of us to go in and think that we can put a plaster on there, it's going to heal better than the body would have healed the first time, or things like that. I just think we underappreciate how incredible and intelligent our bodies actually are. The thing I love, the sciencey stuff, yes, all of that cellular level, how the cells react to their environment around them. And then they're always trying to go for healing. They're always trying to do good for us physically, which is kind of fascinating as well. Yeah. So nerves, fascia, yeah, all that stuff, lymphatics, all dovetails together for me, the science does. I'm not sure if that really even answered that, Elicia. You got to go.
I think it's a great answer. What do you want them to know about scars? What do you want me? What do you like being asked?
No one really asked me anything about scars, really. I mean, it's just student questions. I actually do think we just overcomplicate scars. I actually do believe that. In our workshops, we don't spend a lot of time explaining the theoretical components. Yes, they get covered. And people are given a booklet that they can go home and read to reinforce that information. However, what fascinates me is if they really don't know anything about the cell biology or the fascia or the nerves or the lymphatics, they can still use these techniques and make incredible differences and changes to people, which will probably annoy people who really, really love the science. But actually, you don't even need to know it to make a difference. I didn't know it when I first started out. And as I've as I've gone into more the training side and the educator side, I've had to learn all of these components because some people ask me. Lots of people don't. They're like, it works. Yes, it works. Yeah. Things that I wish people knew. Yes, you can massage. Oh, I'm not going to say massage. That's the wrong word. Yes, you can help people who have older scars. Absolutely. Even scars that are 50 and 60 and 70 years old, we can help those people. And they can often be the root cause of their presenting problems. So a low back pain or shoulder headaches, whatever it is. The other thing that's important to understand is there's more to this type of work than just the hands-on techniques. So much more. Scars impact us socially, physically, emotionally, psychologically, in all of these ways. And when you start to look at it through that biopsychosocial model lens, you're like, oh, I get it. I get it now. So in the program that we have, every single case study that we present for the learners really does display a different quality of the impact that scars make, not just physically, but also with body dysmorphia, which is like when we have we believe our body looks one way, but actually the reality, it actually only looks that way to you. Which is really fascinating. So we have a lady that comes and says, my scar's huge and ugly and red and purple and oh, I hate it. No one sees it. I don't touch it. I never wear shorts anymore. And she shows me the scar. And it's literally the size of my thumbnail. And it's pale pink, in my opinion. That's not her reality of it. So it's being able to cope with when you're faced with issues like that and being able to do the communication in a kind and sensitive way with people who have a different reality around their scars and how they're actually impacting their lives. That's fascinating to me. And we can really make a huge difference to those people.
And what about scars that are more freshly formed? So you've spoken about the work we can do with scars that are, 10, 15, 20, 50, 60, 70 years old. And we've seen evidence of this in the workshops that we do, which is amazing. Literally right before your eyes, you can see the transformation that helps somebody who's lived with something since they were 15 and they're now in their 70s. And that's just super cool. What about somebody who's just had maybe a planned or unplanned surgery? When is it okay for practitioners to touch scars?
No, this is such a loaded question. I say once it's healed. Yeah. But when is that exactly, Christine? How many weeks is that? Well, healing is not exactly a linear process. So there is no an actual, okay, you've got to 7 weeks or 8 weeks or 10 weeks or 12 weeks, you are completely and utterly healed because of the healing process itself. So the healing process happens across 3 stages. Every stage has a set time, and then it moves on to the next stage. At any point in the healing process, if that gets interrupted, it automatically restarts. How clever is that, right? So in one scar, we can have multiple and many different stages of healing at the same time. I'm very conservative when it comes to touching new scars. I prefer to wait until a scar is at least 8 weeks old. And then I look at it and I say, oh, yes, what a beautiful scar. And I have a look and I can see if it's got most of the healing done. If the skin has closed, yes, that doesn't always mean it's healed. So healed means that that fascial glide has been restored, that the fluid is flowing properly, that the nerves are actually signaling in an accurate manner. And we can't usually tell that without touching. So we do, when someone comes, a way for me to assess that is to ask them a bunch of questions, take some photographs, get them to move around, do some assessment of actually what's happening close to and far away from their scar.
Yeah.
So, short answer, I would say go for your 8 weeks. However, be prepared to say, oh, I'm not sure I should work on this. It doesn't look completely healed. Therefore, let's do something gorgeous away from that scar site today. And that's what I would do. You can always help someone. You can always do something, even if that is, a beautiful head massage or a foot massage or a hand massage or whatever that they're comfortable with. You can always do something to help that person feel more at ease within their body. For those who have done specialist courses that are post-operative lymphatics courses, you will probably have been trained to work with someone within days of their operation. And that's fine if you're insured for that. If you're not, if you haven't done a specialist, something like VODA or Casey Smith or something like that, just stay away from scars until they're healed. The body's really, really smart. And also, there's no hurry. The scar is actually always going to be there. It's always going to be there. And what we're actually doing is we're softening the tissue around the scar to help that fluid flow, the lymphatic flow, the circulation, so that your nerves are nourished and fed and actually relay the signals in the body correctly. And that the fascia, the way that that's laid down, is actually in a softer way, I'm going to put, rather than scar tissue way. Yeah, that's what I'll say to that. I'm oversimplifying science, but there you go.
No, I think it's important. I think it's important for us to understand, why there's no rush. If we can treat a scar that is 50, 60, and 70 years old, there is no rush. It can be 8 weeks and fully healed. Tick, job done, unless you have further training, which makes so much sense. So much sense. So, Christine, for those who maybe haven't heard of gentle scar therapy yet, because it is an emerging modality, and it wasn't something up until about 6 years ago that I had ever heard of. Didn't know it existed, and as somebody who lives with scars, that has been a very big surprise to go from very unaware to problem aware to solution aware, and now understand and have the skills myself. What should we be looking for in terms of how do scars affect our clients? Like, what would we be noticing in our clients if they have scars potentially?
Right. Yeah, great question. What I tend to notice is people are coming in, let's just go with the old low back pain. So people will be coming in for low back pain. You see them, you do all of your amazing skill sets that you have already, and they feel pretty good. The people feel pretty good, maybe for a couple of days, maybe a couple of weeks, maybe even a month. However, that low back pain is returning. And in my training, I was taught to believe that that was really the client's responsibility, like they were using their body in a way that was unhelpful to them, that would create this need for maintenance massage that, we would just be doing the same massage over and over and over again. So that's one way to tell. Another way to tell is you can ask if you have a client who is coming back like that and you feel that your treatments are just plateauing. We're getting to 2 days or 2 weeks, and then it just comes back, and you're just repeating that cycle. Back in the day, when I didn't know to ask if people had a scar, that's one of the first things I asked people. When I didn't know if they had a scar, I'd be like thinking, what did I do wrong? Why isn't this person like having a resolution of this problem? I must be missing something. And the thing that I was missing was in the health history, and it was the fact that they had a scar. So when people have a scar, it can impact their body close to and distant from the actual scar site. We know that because 95% of all surgeries develop adhesions, and that is across. It doesn't matter what procedure they've had or where in their body they've had it. We know that 95% of those procedures will end in an adhesion. And that's stats from the American government. And the only reason why that much research gets done, and that research was done it's been done year on year, to be honest, but that one is quite a recent one. But the reason why we know about that is because it costs the American hospital system something like $2.5 billion per year in additional surgeries and additional days in the hospital for patients.
To remove adhesions.
To remove adhesions, yeah.
Wow.
Yeah. And we know that for surgeries that are in the abdomen or pelvis, 60% of those surgeries will cause a small bowel obstruction as well. So adhesion and a small bowel obstruction, 60% of abdominal and pelvic surgeries. Wow. So anyone that comes to you and they've got problems with their digestive system, their bowel movements, even their urinary tract system, yeah, and they've had a scar, we can help people with that.
Wow.
Yeah.
And I know this is a bit more of a visual, which for podcasting is a little tricky, but one of the ways that you explain this as through a t-shirt twist. Do you want to maybe use that analogy?
Yeah. So the t-shirt twist is where is the best way I have found to visually describe all of those adhesions impacting a client. So they might come in with low back pain, and I say, do you have any scars? They say, yes, I've got an abdominal scar. And what I'll do is I'll pull out my t-shirt at the front and I will twist my t-shirt around. And what that does is it creates all of these tensional lines from that twisted t-shirt in the front. I'll pull it out a little bit, and then the tension is felt around the back of the person in their low back area. And I'm like, so this is actually what your scar does. And they go, oh, I didn't know that. I said, not many people do yet. And they'll be like, so usually like in the webinars and, workshops, all the things in the course as well, I'm just like, listen, take this. It's a gift for you to take this and show your beautiful clients, this is the impact of scars on the body 3-dimensionally.
Yeah. So good. It's such a good example, and to help understand that even if you think of like a shoulder surgery, it's like I'm feeling that. If I do that to the front of my shirt, I can feel that. Like if I've got it on my right shoulder, I can feel it on my left neck. Yeah, and I can feel it all the way through. I can even feel it under my left shoulder blade as well. That's like So
right.
For me as a practitioner, one of the things that I've been thinking about is that, do you know the 3DI books back from the 90s? Yeah, you get them from the library and they're these it's a piece of paper that just has I don't know, like the static you used to see on TV, but it's colored. That's all it looks like. Yeah, it's just a pattern on there. And I remember looking at it and not having a clip and be like, oh, I see a pirate ship. And I'm like, I don't see a bloody pirate ship for me. It's just gobbledygook. It's just a flat page. What are you talking about? And then all of a sudden, I get that dimension, and the pirate ship comes out. I'm like, oh my gosh, I can see a pirate ship. And I feel like that's what scars have done. It's like opened up a whole different dimension to way that I see the body, see the different compensation patterns. Because if somebody has that fascial, the how that affects the fascia through those adhesions, they have to walk differently in order to compensate for that. And their body is doing a brilliant job until they end up in pain for whatever reason. And releasing that scar then helps breathing and moving and lower back pain. It's like, I feel like when people understand the depth of scars, it's like seeing the pirate ship. And so now when someone sees it, I'm like, they saw the pirate ship. Yes. And that's what I do inside my head. I get super excited.
That's funny. And it's true. The compensation patterns are fascinating in themselves. And that's just because the body has adapted out with the need to continue to adapt. Yeah. So when someone has a scar on their abdomen, it can be really sore to take a really big, deep breath. So they just start breathing up here.
It was easier.
Yeah, it doesn't hurt.
No, exactly.
It doesn't hurt. So obviously, I'm just going to do things that serve me. I mean, that's what my body does, right? Unfortunately, by not taking the deep breath down here, we're not getting as much oxygen into our system, obviously. But also that pelvic floor gets deconditioned. Yeah. So by breathing up here, we're actually impacting our pelvic floor. And that's can be really hard to then re-educate, and can take a long time. I mean, when we think about the neuroplasticity of the brain, it takes 8 weeks to rewire anything. So it's going to take 8 weeks to rewire one thing, and just do one thing at a time. Don't try to you can maybe do two, but that would really be it. So rewiring to breathe deep is number one.
Yeah.
And then we need to 8 weeks of that. And then the next 8 weeks, you're going to be pelvic floor activation. Because if you can't breathe deeply, you actually can't do pelvic floor activation.
Yeah.
Which is oh boy. So this person, not only are you going to work with their scars, but you're going to help to create a lot more body awareness and things like how to breathe deeply. We can free up all of the intercostal muscles. We can work with the diaphragm. We can do a lot of work through, all of these muscles in here are going to be super tight, super tight. Yeah. Because they're just overused.
Yeah.
And even be getting headaches and neck pain and other issues that are actually related to their scar in a secondary way.
Yeah. And if you can help release the area where the scar is, the person is able to breathe better, which then takes all the pressure off their shoulders, which then relaxes the trigger points so that headaches are gone, and then reactivate the right innervation to get the deep breathing happening, things start to change.
I was going to show you because the other thing is there is, when we think about the abdomen, there's a pressure issue in there as well. So it's not only just the physical stuff. I'm looking onto my desk for a balloon for you. I have a little kind of shriveled up one, but it might actually work. Okay. I've got big green ones. Let's see. I think this one's too full. Okay. Hold on a second. If you see this little shriveled up one, this is actually going to work brilliantly. So if you imagine like this is your abdomen, we've got, I'll make it a bit more abdomen shape. So that's your diaphragm, and this is the pelvic floor down here.
Christine, for those that are listening, because this is a podcast, she's got an upside down small balloon that looks like it was probably bigger before and now it's shrunk down. Yeah, so it's kind of squishy. And she's got the blown up bit at the bottom and the round bit at the top. Go, Christine.
So inside, we've got the gas, the air that I put in there, okay? And it's creating a surface tension on the outside. It's not taut, really. But if I change the shape of the balloon by altering how much space there is in there, so if I squeeze this balloon, it deforms. Yeah? So what happens is, if I have a scar, it's going to take up more space. So let's just say I've got a scar in this area underneath, like near the pelvic floor area, and I push that up. Yeah. It's actually creating more tension and tightness inside the balloon that then deforms the space. So we've got in the abdomen, it's not just diaphragm, pelvic floor. We've got abdominal wall as the balloon casing. So anything that we do in there changes the system pressure, which then will change how the whole structure actually performs, which will tighten things, which will then send a signal to our nervous system that something's happening. And our nervous system, through the enteric nervous system in particular, which is our vagus nerve, 10th cranial nerve, largest nerve in the body, fastest nerve in the body, it goes... I almost said butt-brain connection, but I won't. I'll say gut-brain connection.
Yeah.
I often say butt-brain. I'm like, no, that's not right. It's gut-brain.
Yes. Love it.
So what happens with that is the gut sends signals to the brain more times than the brain sends signals to the gut. And the vagus nerve and the enteric system is where we process the emotion of pleasure, but also of fear. Yeah. So when we have butterflies of excitement, that's your vagus nerve being stimulated, and there's been a pressure change in that cavity, a peritoneal cavity. And if we have a fear, that flip of I got a fright, or went on a roller coaster, or that's a fear response. Yeah. And that's also what happens when there's a pressure change, and then the nervous system picks it up. So not only do our nerves have signals, our nervous system is involved in scars as well.
Wow.
Yeah, I know. That's a lot. It's a little...
This is the nerdy, sciencey stuff that's like, and that's why when someone stands up after having a Christine sandwich, when the nervous system is relaxed and the cavity is then settled, That's why you had such a huge response to that. And it's what I forgot to ask is how long did it take before you had significant period pain again from a 10-minute session?
It was like ages. It was like 18 months. 18 months.
So 10 minutes worth of work that felt like nothing and felt like 3 lifetimes, but wasn't, ended up resolving pain for up to 18 months.
Mm-hmm.
And did it ever return as severe as it had been?
Yeah, it did. But, I think
18 months later.
18 months later, yeah. And yeah.
That's not 10 minutes or 2 days or a week or a month, or that's 18 months, a year and a half later.
Yeah. For 10 minutes. It's mind-blowing, isn't
Imagine
it?
if she had 30 minutes or something, like.
Oh, right. I know. What would have happened?
Wow.
And the thing is, when I say that, I hear therapists going, so I do that and I'll never see that client again. It's like, no, that's not true, because there's other things going on. Their body actually does need a bit of support and re-education. Mm. And, I've had clients that their scarring and pain that they were in was so severe. I was seeing them 3 times a week for half an hour sessions because I could barely touch them. I mean, they couldn't actually function in the world without very severe painkillers. And I was working in tandem with their physio, who was just like, yeah, I have no idea what Christine's doing, but it's working. So keep going, see Christine, and come back to me, and we're going to work with your exercise physiologist. You've got a plan. She had a pain diary. She gave me her pain diary.
Wow.
When we finished working together. 2 years on, and we as we were getting progress, we'd space out our treatments and go, how are you going? Did you manage okay? Yeah. So it was quite incredible, the work that we were doing together. Yeah, it was amazing, actually.
And it is, we've seen it in a man who came to the workshops, who was a client of mine for a long time. So I massaged him for the best part of 20 years he had a life-altering accident in the late 90s, and massage and Bowen made a huge difference for him every 4 weeks. Yeah, so if he didn't have his treatment, he knew about it, his body was sore, etc. And I said to him, why don't you come in and have some treatment for a workshop? Are you available? He said, sure, and came in. And within that, after that one session, didn't require any treatment for 3 months, and then has just seen me as needed because he feels good, not because he can't breathe now. He just is feeling good.
Which is amazing. Amazing. Yeah.
Cool.
Very cool.
Beautiful.
Yeah. Huge difference.
Yeah. And what that has led to has been travel around the country.
Yeah.
Something that he actually wasn't sure he was capable of and put off for some 20 years. And having the confidence in his body again allowed him to go and do something that he didn't know if he was capable of doing, which is pretty, this is where I get goosebumps because it's so cool.
Absolutely life-changing. Absolutely life-changing. And I think for me, there's just more to this than someone comes out of hospital, you're doing a little bit of, touch therapy on their skin, near a scar, handful of techniques and see you later. To me, that's just the tip of the iceberg, really. It's not really the people I work with. Yeah, the people I work with have been having issues for a lifetime. They've been everywhere, and they've somehow managed to find me. And I'm probably one of the first people that have said, have you got a scar? And can I look at it? Do you touch it? Can I touch it? How do you feel about it? And I asked them all sorts of interesting questions about their scars. And it's like I've just put on my Sherlock Holmes hat and like, ooh, what's going to happen here then? Yeah, let's have an adventure together with you, your body and your scar, and find out what's going on. And, the feedback I have had is that it genuinely just changes how they live and operate within the skin that they're in. It's just mind blowing. And their families are like, wow, what happened?
Who even is this person?
Yeah. So because they're suddenly more confident, they feel, and what they say is, I just feel like myself again. Which is like, that's pretty cool. And there's not this same reliance upon, you have to come back week in, week out, blah, blah, blah. For some people who are really severe, yes, that is true, but it's not a forever situation. Yeah. And that's where knowing how to be, to get your message across is so important with scars, and what a realistic expectation is from what we can do, what we can help with, and what might be, that might be better left its own devices, So, I mean, I'll always offer a word of caution after my lovely mountain biking friend. He was born with a club foot and multiple surgeries. And he said, Christine, I'm going to go in for surgery again. I'd love for the scar tissue on my foot to be, softened up so that surgery is going to be successful. I was like, all right, okay, cool, no problem. And I worked with his foot. And then the next day I get this call. Well, actually a text message, then a call, because I called him going, text message saying, Houston, we have a problem. I'm like, what sort of problem are we talking about, Calvin? And I called him and he was like, I can only put one shoe on. My other shoe doesn't fit. I was like, excuse me, what just happened? He's like, well, my foot's just gone flat. It's just gone bigger. And I was like, send me a photo. So he sent me a photo. And I'm looking going, oh my goodness. His scar tissue had formed the instep of his foot. His scar tissue was being helpful for him. Yeah. So there's always part of this is assessment, and part of it is a conversation that says, so what might happen if this changed in this way? Would that be helpful for this person or not? So always kind of going, it's not just about me and my overexcitement at using scar skills, because that can happen when we're learners. We can get super overexcited about scars. And everyone comes in, you're like, oh, scar. Oh, can I? And it's just a word of caution. Just reality check. How helpful is that scar actually being for this person? Because that particular chap, luckily he was a dear friend, and he just thought it was a bit funny, and he just had to wear a big thong on that foot and his normal shoe for a couple of weeks before his next surgery, and then scar tissue was back.
Doesn't sing.
His foot wasn't really as the same size as the other one, but it wasn't as big as what it had been. It hadn't collapsed. And that wasn't something I was expecting. So it's a big learning. Like, all of my clients teach me something. Every single person. It teaches me something, even now. After all this time of working with people with scars. And I think we can get too cavalier, too, oh yes, I know what I'm doing because I've got training. But actually, it's okay to say, I don't actually know how this is going to work out for you. Best case scenario, worst case scenario. What do you think we should do? So people are getting the opportunity to make an informed choice in the treatment that they are choosing. Even if you have just the smallest inkling that, I got a feeling about this one, not sure about this, right? Then people can always make their own choice.
What about some of the symptoms? What are some of the symptoms that people with scars report experiencing?
Well, you know this firsthand, right? You know this. So numbness, also hypersensitivity. So that's like, when we're a little bit more sunburnt sensitive to touch. We can also have itching. And that was something that was a bit of a surprise for you.
I'll share my story in a sec. Keep going with the list.
Can also have, gosh, we can have compensation patterns. We can have adaptation. We can have swelling that is unexplained. We can have secondary conditions form like lymphedema. What else can we have? We can have, just functional problems like a reduction in range of motion. Like I can no longer reach above my head after having some lymph nodes removed, or I've developed a limp after, hip surgery or knee surgery. These types of things can happen as well. And we can also develop things like I'm just not as confident in myself. Like, let's say I've got a facial scar, something like that. Or let's say it's a burn, then I might have a deficit of sweat glands. Yeah. Or hair. It's a grafting site. So one of our lovely clients, her client had a skin graft from her groin as a small child to her ankle. And when she went through puberty, this patch of skin actually developed pubic hair on her as a teenage girl. Confronting, right? Yeah. So we can do all sorts of things. Amazing, right?
Yeah. It's phenomenal. I remember sitting in a workshop. Though I had, so if you haven't heard my backstory, my literal backstory, I had scoliosis surgery at 15. So I have a scar on my back and I have a scar in the side and a drainage hole as well. And I was sitting in this workshop learning about scars, all very new, the teaching assistant hadn't done the course yet because it was a bit confronting, to be perfectly honest. And I said that to Christine. She's like, when you're ready, let me know. I'm like, I wasn't ready. And I wasn't ready because I'm like, I know how I learn and I'm going to have to feel all of that when I learn it because I have to try it on. And I'm like, I wasn't ready. And kudos to you for allowing that space. And I remember sitting in this workshop in Sydney and as a team, you and the people that were learning wrote out a list of all these different symptom pictures of what can happen with scars. And I sat there going, what? The actual beep? Because I'm like, if you're all talking about a symptom picture, that means you all know about it. And if everyone knows about it, it means other people have reported it, which means the stuff I experience in my back is not unusual or like it's actually something that other people talk about, which for me, I have numbness and not as much now, but at the time I had numbness and tingling and hypersensitivity, which I didn't even know was a thing. But for me, that looked like if I get one of my long curly hairs from my head stuck down my shirt, if you ever see me strip naked in public, it's because there was a hair on the back of my shirt and I can feel that sucker. You can scratch my back and I can't feel nails, but I can feel a hair. That's hypersensitivity. Okay, good to know. And James used to get the loofah gloves and just in the shower and he'd be like, you weirdo, like, what's wrong with you? Do you even have skin? Apparently it's to do with lymphatic disruption when having surgery that I just had no idea about, that this was even a thing, which blows my mind because at that point I would have been practicing for over 20 years. I'm a remedial, which I'd breathe down my quals, craniosacral therapist, Bowen therapist, and I don't think of myself as a particularly closed-minded, it has to be this way kind of practitioner. I'm very open. And the fact that I had no idea that there was this scar thing out there was like, not only that, but that I could be treated and was treated in that workshop and it changed. I think it would change my life. Like it really, I now only need, someone to scratch the crappers out of my back maybe once or twice a year. I can breathe better, and I have a lot more comfort in my body, and I can tell when my scar is just acting up, and I think, oh, I need to go and see someone. Is Christine coming down anytime soon? No. Okay, great. I'll go see the local people and, go and find my therapist around and go and see them and get some work done. And it just makes a profound difference. Yeah, which is pretty cool.
Very cool. Very cool.
So Christine, if this has really piqued people's interest, if they are like, what? Scars are a thing, this is huge. Or maybe they are, way more intuitive than I ever was and noticing how scars are affecting their clients. What do you recommend? How can people learn more about this amazing modality?
It is an amazing modality. How can they learn more about it? Well, if they wanted to access our training that we have, which I think is phenomenal training, which I've actually put together with so much care and attention. It was a bit of a labor of love, to be honest. And it did take me a long time. So I filmed it all and went, oh gosh, I'm not sure how to put this all together. And I just put it on a shelf for a really long time until I came up with the brainwave of how to actually put this together and keep the students that are watching safe, as well as showing real treatments with real clients. So that's all been put together in a way that feels really ethical and really keeps everyone beautifully looked after and real. So I've actually kept warts in and all, because my dream is be better than me. Be better than me. Okay. I learn from my mistakes. So it's an entire modality rather than that level 1, level 2, just enough to make you think, I kind of know what I'm doing. This is actually an entire modality. So you are well equipped to treat and serve beautiful people who have multiple different types of scars, whether it be a burn or a skin graft or a crushing incident, a dog bite, surgical scars, from life-saving situations, or if they've been involved in, some sort of accident or an act of crime. You will have the tools to support that person through their healing journey with you in your practice. I know. That's kind of a lot, right? So we do touch on all of the science, how scars impact lymphatics and nerves and fascia. There's a lot of fascia talk in there, which I do the 5-6 syllable words, but I also say the normal words too, so that you can have a translation if those big words aren't really your thing. If they are
the tropic nature of fascia, Christine.
It's the tropic nature of fascia, yeah. All of those ones, the hyaluronic acid and the proliferation. So if you want to hear me articulate my R's a lot on those big words, knock your socks off. That box will definitely be ticked. What else do we cover? We cover all sorts of things in there. How do people find out about it? Well, you can go to our website.
We'll pop the link below, specifically for scars as well. Yeah, we'll pop the link below so people can find out about that.
Yeah, I'm actually immensely proud of the Gentle Scar program. We do a lot around trauma-informed care and different client types and different types of scars. And you'll find out that the techniques is like kind of 10% of what we do in the clinic. And it's not super complex. You don't need tools. You don't need any extra equipment. You don't need any creams or oils or anything. It's simply you, your client, and your hands, and those beautiful, sophisticated touch tools that we're all so incredible at, really. And it's really that mixing the intuitive and the technical aspects and theory as well. So it's really, everything comes together. As far as I'm aware, it's the only course I know of that you get everything in one go.
And you do a case study as well, Christine? You get your students to do a case study?
Yes, we have the case study, and that is So exciting. We get so excited about presentation week. That's what we call it. So the case study isn't like our diploma case study where you have to prove to the teacher how much you know. This is to prove to your client why this would be a great thing for them to do if they have a scar. So we take you through the whole process. It's just one client, 2 treatments. And it's super simple, really. And we just create a piece of marketing or educational collateral as an asset in your business. So that if someone says, oh, what's all this scar business about? You say, oh, here's something I prepared earlier. And you can just send through your pictures and your blurb about what it is you've been doing. And we help you with before and after photos. And we've got some pre-made social things as well that get through the the Facebook and the Instagram and all of these things as well. So yeah, I could just talk forever about it. Actually, it's a bit embarrassing.
It's awesome, I think it's so helpful because we see, I mean, there are 250,000 scars created each year through surgery here in Australia. Is that the right statistic?
2.7 million each year.
Right. 2.7 million scars created here in Australia.
Each year.
Yeah. And 95% of them will end in adhesions. Is that what you said before? I just make sure I've got the stats right. Yeah. So if this is a emerging modality and there's like maybe less than 10,000 practitioners worldwide, I would suggest there's more like 5,000 practitioners worldwide who are currently treating scars. That's not enough practitioners. So if you're looking for a modality that will set you apart and you want to be in the pioneering category of actually utilizing your hands-on skills in such a profound way, there is so much demand for gentle scar therapists. And it is such a light. I mean, as a lived experience, both of us have lived experience of how powerful and profound this work can be. Yeah, I think it's beautiful to hear your passion and your heart, as well as the nerdy sciencey stuff as well that you just get super excited by. It's great. I love it. So yeah.
Yeah, just, as closing, I would probably say scars are really common. Scar-informed care is not. That's an opportunity.
Yeah. So good. It's amazing. Thank you so much, Christine. Really appreciate your time today and being able to have a conversation with you about all of this. And I trust this has been super helpful for our listeners as well.